Sports physical therapist. Typical responsibilities of the job include, but are not limited to, are focusing on athletes by treating and avoiding sporting or activity-induced injuries and to rehabilitate them when they sustain injuries. Help athletes to recover and improve performance. Help athletes reduce pain when they are stuck with pain or overexertion of muscles and to regain complete mobility and get back to their sporting event better and stronger. They also work closely with primary care doctors who are specialists in sports medicine, as well as orthopedic surgeons in evaluating a patient's injury and creating a treatment plan that help them return to their sporting activities. In addition to this, they must follow the key areas of competencies listed out by the Society of Sports Therapists that include prevention, recognition and evaluation, management, treatment and referral, rehabilitation, and lastly, education and professional practice issues. Average salary in California. According to Salary.com, the median salary in California for a sports physical therapist is $88,329 a year. The lowest 10% was $75,000, and at the highest 90% was $100,000. Academic requirements. In order to become a sports physical therapist, one needs to obtain a bachelor's degree in kinesiology or something along the lines of kinesiology like exercise science or athletic training, and after that they would have to get a master's in either exercise physiology, occupational therapy, or rehabilitative science. After the master's, they'll need to get a doctor's of physical therapy, which can take a long time, and in addition to all the schooling, one needs to participate in residencies that can last between 9 and 36 months or 1,500 hours, and a fellowship in learning experience that is focused on clinical practices, education, or research, and these fellowships can last between 6 to 36 months or 1,000 hours. Typical work environment / working conditions. These can be, but are not limited to, professional sports teams like the NBA or NFL, healthcare centers like Kaiser, rehabilitation centers like a PT clinic, and fitness centers in general. Certifications or licenses required. One needs to obtain a physical therapy license, and they can get this certification through the American Physical Therapy Association. After they get the physical therapy license, they need a specialized certification called the Specialist Certification in Sports that can be obtained through American Board of Physical Therapy Specialists. Common population sports physical therapists work with. These can be, but are not limited to, collegiate athletes, professional athletes, as well as the general population that are involved with sports. Professional associations / affiliations. One of the professional associations / affiliation is the Society of Sports Therapists. This logo can be found on the basketball. The next one is the American Academy of Sports Physical Therapy, and the logo can be found on the jersey. The next one is the American Board of Physical Therapy Specialists, and this logo can be found on the free throw circle. And lastly, the American Physical Therapy Association is one of the major professional associations / affiliations where all physical therapists are a part of.